you'd be aware of the figures that 2/3 of the requests came from regional New South Wales, where 1/3 of people live. Does this raise concerning issues with respect to access to healthcare in the regions and access to palliative care in the regions?
I would actually say that those figures are a testament to the staff and the implementation by our local health districts, who have worked very hard to ensure equity of access.
So you're not worried that those figures actually indicate perhaps inequity of access to underlying healthcare?
I'm not concerned about... I would be concerned if that was what I believed after my engagement with the local health districts. There's been very much a lot of engagement with our local health districts as we've implemented that, and based on that input and the advice I've had in relation to the cases and the fact that as part of the process people actually make it sure that people have had the opportunity of linking to palliative care, and those issues have been prosecuted as part of the voluntary assisted dying process.
Thank you.
I'm confident that that is not the major driver for...
Well, the Go Gentle State of VAD report suggests that reduced access to health services in the regions is in fact a factor which drives the much higher rate of access to euthanasia in the regions. Would you agree with that?
I'm aware of that assertion within the Go Gentle report. All I can, I suppose, reflect on is the facts before me, and all I can reflect on is my engagement with the local health districts, with the clinicians involved in voluntary assisted dying. I think it is something that we obviously are very concerned about if that would be a factor, but as I said, that isn't what...
But is it a factor that anybody has sort of taken into reflect on in a policy setting? Because if you've got a situation where 1/3 of the population is choosing something twice as much as the city, doesn't that at least suggest it's an area that should be explored in terms of, is there adequate access to healthcare in the regions?
So all I can say is that part of the assessment process when the clinicians are talking through this, so it's very experienced, the legislation requires very experienced clinicians to be involved in voluntary assisted dying. There's a comprehensive clinical guidance document around it. It is... The feedback I've had from my engagement with the authorised providers is there's a lot of care and attention that there are not preventable factors.
Dr. Chan, thank you, and I appreciate the detail, but the question I was really asking was, if in any other field we saw that the regions were accessing a particular option twice as much as the city, I would hope that that would be a red flag, at least for policy consideration. And when you've got the regions accessing death twice as often as the cities, I think it should be a red flag for policy consideration. That's my only question in relation to that. And I'm surprised that it's not.
And I think you've misunderstood, or I've misspoke in the way that I've answered you. Obviously, we're interested in the concept of whether people are at all influenced around voluntary assisted dying because of lack of access to some of the other...
And that's being investigated?
And as part of the process by which the board reviews the cases, there are questions about the patients accessing palliative care. There will be a more fulsome report available, but I can reassure the committee that all of those parameters are considered.
Because you would acknowledge that in the interim report, that question was not even engaged with by the board.